Hello guys, welcome to our channel. In this episode, we will discuss one section of your CPT coding, which is the anesthesia coding. I am the medical coding guy. Anesthesia coding is one of the easiest sections in the CPT, but you have to remember a few things in order for you to ace it in your upcoming CPC exam. But let's discuss first what is your anesthesia coding. Anesthesia code sets are usually tied up with your surgery codes, and it's a state of the patient feeling no pain, or the doctors will use this to numb a certain body areas or regions of the patient. Okay? And these are the things to remember for your anesthesia CPT coding. Usually, it contains your short questions in the CPC exam, but don't underestimate this because there are some rules and some guidelines that you need to remember, you need to watch out, like your physical status modifiers and your qualifying circumstances. Also, please watch out for your excluded services that you can also tie up with your with your anesthesia codes. Okay? What are the types of anesthesia? So we have 4 of them, okay? But again, whenever we will be coding your anesthesia codes, we will only think of these first 3, which are your general, your MAC or your monitored anesthesia care, your regional, but your local will not be coded. Why? Because it's already included in most of the surgeries, whether it's minor or major, all right? No need to code if done with the minor or major surgeries, okay? So just check the slide here in order for you to know what's the difference between these 4 types of your anesthesia, okay? Let's jump to your physical status modifiers. Anesthesia procedures have their own special set of modifiers, which is very simple to append, and it will correspond to the condition of the patient during the administration of anesthesia. Physical status modifiers and your qualifying circumstances are located in the anesthesia guidelines in the CPT book. So let's take a look. Alright, so it's located here. And again, just append this P1 to P6 modifier in conjunction with your anesthesia procedures. And take note that Medicare does not recognize or pay any additional units for physical status. However, for some private insurance payers, you need to somewhat watch out for the additional units that you will be applying. So for example, for P3, P4, and P5, you will be appending additional number of units for them. For example, for P3, additional 1 unit, P4, additional 2, and P5, additional 3 units. So you need to identify those as well. Alright? And let's now go to your next one, which is your qualifying circumstances. So this qualifying circumstances, as you can see, it's used to signal abnormal circumstance. And these are the codes, or an add-on codes, to be exact, that you will append in conjunction with your anesthesia procedures. Okay? Same as your P1 to P6 modifiers, all right? Because your qualifying circumstances here provides additional units in conjunction with your anesthesia procedures, okay? So just check the abnormal circumstance of the patient during the administration of the anesthesia, okay? So please take note about this qualifying circumstances. It is located right after your P1 to P6 physical status modifiers. It's all here. So let's say, for example, a patient is a 75-year-old patient and the doctor will administer anesthesia for this patient. So just add your 99100 for that specific procedure. Okay? So please take note about this. All right. So let's now proceed to your anesthesia modifiers. And this anesthesia modifiers are going to be appended towards your anesthesia codes directly as well. All right? Whoever did the anesthesia procedure for the patient, whether it's done by your anesthesiologist or your CRNA/anesthesiologist assistant. For example, the anesthesiologist performed directly the anesthesia for the patient, just append modifier AA towards that anesthesia code. Please take note what CRNA stands for. That's your Certified Registered Nurse Anesthetist. Alright? So please take note about these modifiers as well. Okay? Now let's jump to some questions I prepared for you for this topic. Mr. Vince McMahoney is admitted for an open plural biopsy Again, when coding your anesthesia codes, please take note what is the surgery that was done or what is the procedure that was done, because you will correspond the anesthesia code in conjunction with the surgery that was done. Okay, so this is an open plural biopsy procedure with OLV. That's your one lung ventilation, and the patient receives GA. So GA is your general anesthesia, so you can code your anesthesia code here. Okay, the anesthesiologist medically directed two other cases. Okay, so let's put here case number 1, case number 2, and also medically directs a CRNA in this case. So let's put the CRNA on the third case here. Okay, all right. Please take note that your modifiers can also be appended towards the anesthesiologist, even he only directs what? Other cases during the procedure, even if he or she did not perform the anesthesia personally. And then in this question itself, it's mentioned that what are the CPT codes for both providers. So that means one code for the anesthesiologist and one code for the CRNA. Okay, let's check your code sets here in the choices. So you have 00540 versus 00541. What was the procedure done? Open plural biopsy. So let's check your book. Okay, so just follow with me and try to answer it as well, or you can pause the video, try to answer it for yourself and check if you pick the right answer. Okay, so 00540 is anesthesia for thoracotomy procedure. Okay, it's not mentioned specifically the word thoracotomy. Okay, however, the word pleura is mentioned here. Let's compare it with your 00541. All right, this one utilizes one lung ventilation. So OLV is not mentioned here, but the term one lung ventilation is mentioned. So please take note about those shortcuts and abbreviations as well. So in that case, we'll be choosing 00541 because this is a thoracotomy procedure involving the pleura. So it's an open plural of biopsy, but the doctor utilized one lung ventilation. So we will choose 00541 here. We will eliminate A. We'll also eliminate B. But since you will be having the same code for both the anesthesiologist and the CRNA, the modifiers will only matter here for each of the providers. Okay, so let's check first what's the appropriate modifier for the anesthesiologist. How many cases this anesthesiologist directs during the procedure? Okay, it's 3. Okay, if you will go to your modifiers earlier, so you have this, we will not be choosing AA, of course. Okay, so it's between AD up until QY. But let's check the term. Let's check the magic number here, 3. So 3 cases. So that is where we'll be picking our modifier. So we'll choose QK. Please be aware of this, guys. And for your CRNA, since the CRNA is being directed by the anesthesiologist, you will append QX modifier for him. All right, for the CRNA. So let's check QK and QX respectively. So you have your QK here, all right, and QX for the CRNA. So we will choose letter delta for this scenario. Okay, so see how easy you're going to code for your anesthesia code sets. So please get a perfect score for this topic. Okay, next, last case for this day, a patient named Johnny D is here for an incisional hernia repair. So this is the surgical procedure that was done. So the question here might be, of course, what is the anesthesia codes that we'll be providing for the patient? Let's check. He is an 85-year-old patient, so please take note about your qualifying circumstance, okay? For an 84-year-old patient that will be given an anesthesia, okay? So we will check it later, okay? The patient is also with hypertension. Let's check if this will fall under qualifying circumstance as well, okay? But let's check your code for the anesthesiologist. Since, okay, incisional hernia repair was done for the patient, and we will only code for the anesthesiologist here, we won't be coding for the incisional hernia repair. Please watch out for these choices, okay? We will only code for the anesthesia code here for the anesthesiologist, except when excluded services are done, such as your line placement, your Swan Ganz catheter, and also your CVA, or central venous access, okay? You can append those CPT codes with your anesthesiologist if they are the one who provided those procedures, okay? Let's check the difference between 00832 and 00834. All right. Your 00832 is your anesthesia procedures for hernia repairs. Yes, it's a hernia repair, but what type of hernia was repaired? It's mentioned incisional. Okay, so please take note about this. Versus your 00834, that's your anesthesia for hernia repairs as well. It's not specified here what type of hernia repair would that be. However, it's for younger than 1 year of age. And please take note that the patient is an 84-year-old patient. So we will also eliminate delta. Now we're left with your, so it's a P2 status modifiers, okay? It's already given here. So this patient is under which physical status modifiers again? According to this physical status modifiers, the patient has mild systemic disease, which is your hernia, okay? Okay, so going back, you have your 99116 and 99110 for your qualifying circumstance, okay? Now, an 84-year-old patient, all right? You know the drill. Go to your qualifying circumstance, all right? So you have your 99100 here if the patient is older than 70, all right? Which Johnny D is, okay? So you will append your 99100. Quick notes that your hypertension does not qualify for the use of this additional codes, okay? If it's hypo, it's mentioned here, hypothermia, hypotension. So please watch out for those hyper versus hypo, okay? You might get confused because you're in the process of hurrying up because of the time. So please watch out for that as well. So in that case, we will choose letter C for this question, okay? So it's very easy. Again, just watch out for those guidelines that I've mentioned earlier. And again, I'll be having more of this in the future. So please subscribe if you haven't yet subscribed in this channel. It will help the community a lot, especially with new upcoming medical coders like you. Okay? So again, that's it for this day. And always remember, without knowledge, there is no power. And please subscribe to Medical Coding Guy channel on YouTube. Have a nice day, guys. See you next time.